Good afternoon. My name is Fernando Torrente. I'm the head of the INECO's Institute for Public Policies, and I'm highly honored to introduce you to this panel session, Well-Being and Development, trying to integrate public policies into the social dimension of well-being. This panel session is very important indeed to us all because many a time disseminating the idea of well-being is focusing on individuals and their actions and tasks. But here, after this panel session, we'll see that well-being has a social dimension as well, which is directly connected with planning, public policies, governmental activities, and organizations' actions in order to improve the well-being of the society at large and the well-being of ourselves as members of that society, here, there, and everywhere, all over the world, something that goes beyond individuals. We have a panel session by Florencia López, Marita, Carballo, and of course, Carol Graham. I'm so happy to be here with three women because they represent us very well in the field of neuroscience and their hard work connecting their work to the social dimension. And therefore, it is so important to have you with us today, especially thinking about well-being inequalities in the context of COVID-19. The first guest speaker will be Florencia López Bo. She has a PhD, Oxford University in economics, senior economist in the field of public policies and IDB. She's a member of the IDB staff, and she is dealing with planning and designing public policies, child development, and social protection. And he has authored many papers in this field of study. Florencia, I'm so happy to have you with us today. We have been working together, and our work has been very, very satisfactory in this. So I'm so happy to have you with us today. She will deal with public policies for the new normal. Florencia, the floor is yours. Good afternoon, everybody. A vote of thanks to Fundación INECO for this invitation. And I'd like to share with you the different studies that we have done in the field of behavioral economics, together with INECO, IDB INECO, concerning the new normal. On the one hand, I'd like to stress that the new outbreaks of these pandemics are very worrying indeed, because it shows that it will be very difficult to overcome this virus. Strict vigilance, permanent monitoring, and citizen behavior will determine how we address the pandemic. The World Health Organization says that behavioral changes may reduce the control of this pandemic, and therefore this means that we will have to push people to reestablish normal behavior, to go to the doctor's office, to go to the dentist, and of course, to go back to school. So in order to design these new interventions, we have to know how this pandemic has been affecting behaviors and minds of people generally. Therefore, I'd like to share with you this survey led by INECO Foundation concerning mental health in Argentina. Here you have two questionnaires at the very early stage, 6 days after, and then 72 days after the pandemic. With 3,000 participants, we measured anxiety and depression with normal tools given us by psychology, the PHQ-9 question, and the GAD-7, general anxiety disorder, sleep, energy, Of course, no one should be surprised at the fact that we have detected anxiety and depression at the very beginning of the pandemic. That is very, of course, common and usual. And especially the most remarkable aspects we have seen in young people and the elderly. After 72 days, the impact was much more deeper, and the 72-day questionnaire showed cognitive difficulties, uncertainty, and of course, economic worries, more anxiety, more depression. We have to know about these trends because they help us see that anxiety and depression are obstacles for us to try to prevent contagion because they have a direct impact on the well-being of people. The second questionnaire or survey was conducted with the Secretary for Innovation and Technology of Sao Paulo, Brazil, concerning the use of masks, social distancing, and remaining at home in isolation. Of course, we conducted an experimental assessment. This was an online phone survey, 5,000 phones, identified by gender and district. And here you can see the different aspects: civic duty, taking care of friends, community, and family. Number two, social standards. Millions of people are remaining at home, and you should remain at home. Three, mutual behavior concerning health personnel who are risking their lives. So, number four had to do with self-efficiency and group identity, each one doing its part in order to overcome coronavirus. And last but not least, risk perception. And people may be contaminated. You may be one of them. Do not put other people at risk. Remain at home or 2-meter social distancing. 20% of this sample were subject to the phone call in order to measure the reported behavioral change. All the treatment were effective because they raised much more awareness as regards preventive measures. But civic duty, appealing to your family, your friends, your community, was the most efficient one concerning social distancing as well as enhanced use of masks. Here you have a translation from Portuguese into Spanish. It will be scaled to people living in the districts having a higher rate of contagion, taking into account discontinuity, because of course we didn't have resources to keep on doing that on a continuous way. On the other hand, we have learned that testing and contact tracing is of the essence in terms of pandemic. In Argentina, we know that these two factors are very important, but if we only depend on manual tracing, we should say that this is much more difficult. Manual tracing is much more difficult than digital tracing. We developed an app, a contact app, tracing device, whereby the number of people using it is a key element in the new normal. Another phone questionnaire in more than 1,000 cases in more than 10,000 countries, conditional on the fact that people owned a smartphone. So we took into account a hypothetical app downloaded by the individual and connected automatically. Of course, if the individual didn't want to have the app, he could disconnect it. And we asked them, what about COVID-19 and what do you do? A group of people said, yes, we are going to download actively only if we can, of course, unload it. 52% in option one answered, yes, we would install the official app in my country, and 67% of option opt out. They say, no, we are not going to use it. There is a great variation among countries, so there are more odds and probabilities that this app would be in the Latin American people if the app is by default. But if you have to download the app, Latin Americans didn't want to do it. This is consistent with other studies concerning default options to change behaviors. Another study that I want to share with you in line with contact tracing apps is our support to governments of Ecuador and Uruguay in order to incentivize them to download the official apps ASI in Ecuador and UI in Uruguay. These are the two contact tracing apps. To your right, you can see that we have a logo design that we did with an English consortium in order to avoid contagion in H1N1 pandemic. This tool was very effective at the times of the flu pandemic, so we use it because it is customized on washing hands, and of course using alcohol gel and taking into account the effective communication issue. We also have another study in place, IDV study, Argentina, Uruguay, and the United States, in cooperation with the Torquato Di Tella University Observatory. We see the effect of anchoring, that is to say, given a special figure or number, and the effect of the political position regarding the focus made by citizens on the pandemic's death forecast, and also the effects on the demand for public policies in order to combat coronavirus. 600 participants per country, and we imagine a leader, one in the opposition party and the other one in the party in government. In Argentina, the anchor was 60,000, Brazil 80,000, and 8 million in the USA. To your left, you see that the anchoring was effective. The difference is 5 times the median of deaths forecast for the end of 2020. But there was no correlation between death forecast and support to public policies to combat COVID-19. So public policy affects forecast. To your right, Argentina shows that the opposition party forecast more deaths. And this was so for the other two countries. Another finding that you cannot see here on the screen, there's a relationship between partisanship and the demand for public policies. In Argentina, opponents wanted to have more COVID-19 based public policies, more interventions, which would imply that supporting public policies to combat the pandemic are strongly influenced by partisanship. And we have seen this in many other studies, more than the beliefs of people or the seriousness of the pandemic. Why is it so? Because the communication that we have seen, world communication, not only in Latin America, is driven to raise a red flag concerning the pandemic. It would be effective if we could narrow the gap, politically speaking, and have a united message to the population. Remember the 10 countries where we conducted the surveys for the contact tracing app? Here you have a very burning issue in Argentina and elsewhere, going back to school. We organized a phone questionnaire, children under 5 and children between 6 and 12. So, of course, there are great variates among countries, but on average, when the young child is at home, 80% of Americans answer this question as follows. Do you think that a vaccine should be developed before going back to school and have face-to-face classes? 82% think that these vaccines should be prohibited between children under 5 years. In Uruguay, where they have gone back to school, 27% thought that classes should be forbidden for children under 5. This chart shows you that the new normal will require a clear-cut communication strategy with parents to keep them posted about new protocols and reassure them about the current situation. And in closing, here you have a campaign conducted in Uruguay based on effective communication, dealing with 2 meter social distancing, one of the main tools for the new normal. Washing your hands, 2 meters of the essence. Can you listen? No? Well, all right. Well, we have partly listened to the video. Only 1 minute. Yes, please. Lessons learned. Well, taking into account different studies, surveys, and questionnaires with different Latin American governments, there's a deep emotional impact in the quarantine or confinement, especially concerning depression. People are skeptical about going back to face-to-face classes, especially for children under 12 years. Civic duty has to do with reciprocity with health personnel, the use of masks, and respecting social distancing. Predetermined options, that is to say default options, increase the probability of downloading a contact tracing app. And last but not least, number 4, partisanship is much more important than beliefs in support of public policies to combat the pandemic. Thank you so much. Thank you so much, Florencia, for your presentation and your very interesting data, especially at these times. Now I'm going to introduce Marita Carballo to you. She chairs the WAPOR Association, and also she chairs the Academy of Political and Social Sciences. She is deputy chair of World Value Service, and she is the head of the Sociology Department, Social Science at the Pontifical Catholic University. She has authored many books and papers in this regard. She will deal with happiness of nations.
Thank you very much for the invitation. Understanding happiness is a very complex task. We are always astonished with this. People in general and specialists in particular are interested in this topic. What is it that we wonder? What is happiness? Why are some individuals happier than others? What factors determine happiness? Are there countries or cultures that are happier than others? Income and consumption, are they the main variables for happiness? What can we do from our personal point of view and from public policies in order to contribute to the well-being of societies? How can we reduce the suffering of our people? How can we do this if we want to respect individuality and freedom at the same time? These are some of the questions that we need to answer. I am based on the World Value Survey, which is a research or a survey conducted in several countries every 5 years to measure value changes and also well-being. What is good about this survey is that it is a very big survey covering several value fields and enabling relating several factors that correlate most with happiness to then be able to focus on working on those. Basically, they work on two questions that have been asked systematically. One relates to satisfaction with life in a scale from 1 to 10, and the other with happiness. And the answers are very much, very little, not at all, etc. These questions are highly correlated. Satisfaction is easier to evaluate, while happiness relates more to the emotions. With these two questions, we developed an index, a well-being index. This well-being index has enabled us to rank and see the maps and the factors associated to happiness. You can see the world map where in green you can see the countries that are happiest or with more subjective well-being. As you can see, these include Northern European countries as well as Latin American countries, Iceland, Norway, Switzerland, Dutch, the Netherlands, followed by Puerto Rico, Colombia. They rank higher in the last measurement. And the rest of the countries in our region also show subjective well-being levels that are higher than the average worldwide. Argentina, Uruguay, Brazil, Peru. And the remaining countries have very high levels above the average, such as Sweden, Denmark, Finland, Austria, and Germany. Now we see that there are some countries with high happiness levels, with high economic development, but there are also countries, and I will show you this, which relates GDP with subjective well-being, and you will see that countries such as Scandinavian countries that have high levels of economic development and happiness, and countries in our region such as Colombia, Mexico, Ecuador, Argentina, Uruguay, and others that have mid or low income or GDP levels with high happiness levels. So it's a complex correlation because we can say that economic development per se does not necessarily imply a high level of happiness, of subjective well-being. But we see that countries on the darker side of the map, those in orange in the map, are countries with lower levels of happiness and low economic level, such as African countries, some Middle Eastern countries, and countries belonging to the former Soviet Union. We can name Zimbabwe, Nigeria, Palestine, Algeria, Morocco, Bulgaria, the Ukraine, and the Russian Federation. So we wonder, what is it that makes, we have seen the changes between countries. What is it that makes some societies or people happier than others? If we want to have an influence on their happiness levels, we need to learn more. And based on this World Values Survey, we can detect what factors correlate most to subjective well-being. First, it is personal relations. The quality of personal relations is a determinant for happiness. The importance of friends and family, having somebody to resort to, somebody who talk to when you have a problem, that is a source of well-being. Living with a partner has also been proven to be a source of happiness. The second aspect that appears very strong is health. The perception of health is highly correlated to subjective well-being, and we do not only refer to physical but also to mental and psychological health. And then comes income. As we saw in this chart that I showed you, GDP is not enough to explain the level of subjective well-being, but we see in all countries that we have measured that those who are poorer have markedly higher levels of unhappiness than those who have a higher purchasing power. At the same time, studies also show that when a given level has been reached, making more money will not change the situation much. Another factor that has a strong influence is work. We find that higher levels of satisfaction with work, pride with work, is strongly correlated with well-being. And conversely, unemployment is something shown by studies as a factor that strongly marks people. People suffer much when they are unemployed for a long period, and it is very difficult to recover the level of happiness before unemployment. All of these data are very important for the design of public policy. Another influence is personal freedom, the freedom to make my own decisions, to feel free to make my own decisions. And then confidence or trust. We have an issue in Latin America with that. In the world, confidence is strongly related to happiness, and both people and institutions, the trust is the basis for the good operation of society. While we do not have that confidence, as you may find in Nordic European countries, and that is an important element for their happiness. In our region, that is offset by the intimate family and friends circle that somehow offset that. But we need to be convinced that we have no social capital, we need to solve it, and there is a lot to be done from the field of public policy because this affects our lives, politics and economics. Now, I would like to refer to what is it that is happening with satisfaction during the pandemic. I will focus on the case of Argentina, which is the one I have most data. The last World Value Survey covers 2017-2018, and we do not yet have any data belonging to the pandemic. The latest World Value Surveys for Argentina showed that in 2017, 78% of Argentinians declared to be very satisfied with their lives. And the survey that we conducted with WADE University now shows that this figure has gone down in 2020 to 49%. So 30% drop. And in this same period, the number of unhappy went from 5 to 20% of respondents. Something that I'd like to point out is that we have seen some changes in the composition of the groups. You have 1 minute left. This is minute 11. We also found out that happiness does not appear as U-shaped now. It is now the youth that are most affected. and the satisfied. And also the partners in the relationship between men and women in couples, women tend to have a lower level of satisfaction, and this is also affecting most the poorer areas. I'm trying to reduce the final part of my presentation, but when we asked about feelings in the last week, we found that 7 out of 10 Argentines felt anxious, 6 of 10 did not want to read the news or watch the news and about the coronavirus. 6 have sleeping disorders. 6 have eating disorders. They are under eating or overeating. 4 out of 10 are depressed. 3 out of 10 feel very lonely. And 3 out of 10 are very fearful. And something that we have detected recently is that people are smoking more, they are taking more tranquilizers and drinking more alcohol. There is also a comparison that whose figures I'm not going to show between 2015 and 2020 with various psychological status, but there are strong differences in these results as to psychological quality. And there is a significant difference that needs to be paid attention to. This is the result of the pandemic. And public policy should focus on happiness and use well-being as an objective to choose what policies promise to produce the highest increases in quality of life, taking into account the pandemic and everything that we have seen as to what has an impact on happiness. There are several areas of the world where they are planning, and many governments have included this on their agendas, to develop different policies. I'd like to add that health policies, especially psychological health, social relations, generation of trust, construction of social capital and transparency, work, employment, poverty should be the fields where we need to focus. There is a lot that can be done from public policy and from our personal point of view individually. Each of you can contribute to generating conditions for an improved well-being. Thank you very much. Thank you, Marita, for your interesting presentation and for speeding up at the end because we are running a bit late. It is important to try to remain within schedule because this is one of the adaptations required to these virtual meetings. Thank you so much. We will go back to this when I ask you questions at the end of the presentations.
Now I'm going to introduce the next guest speaker, Carol Graham. She is a senior fellow at the Brookings Institution, professor at the University of Maryland, senior researcher at Gallup, consultant to the IDB, and she has authored many papers and books. She will deal with addressing the well-being inequalities in the context of COVID-19. Carol, the floor is yours, and thank you so much. Thank you so much, Fernando, for this introduction and the invitation. I come from Peru, and I worked a lot on happiness in Latin America, poverty and inequality. Sadly enough, the current status of the USA is so poor these days, not only because of the pandemic, but also because of psychological uneasiness. And I have been working for more than 5 years, especially focusing myself on these topics. Let me share with you some slides. As time is very short, and I studied economics in English. I will make my presentation in English and I will answer the questions in Spanish. So, analizamos el tema de la felicidad y el bienestar para realizar una medición de lo que está ocurriendo en los Estados Unidos en este momento, algo que comenzó hace 5 o 6 años atrás. La búsqueda de la felicidad, que es la independencia y el individualismo, no es solamente satisfacción en los Estados Unidos, sino oportunidades para hacer una medición que determinar la posibilidad de tener vidas plenas, combinando la libertad individual y la justicia social. Pero esta búsqueda no es igual para todos los ciudadanos en los Estados Unidos hoy en día. Les mostraré unas cifras que demuestran lo que acabo de decir. Hoy en día esto está descendiendo muchísimo. Estamos tratando de explorar por qué cada vez más la distribución del ingreso es más inequitativo, al igual que el bienestar. Lo que importa es tener esperanza. Esperanza hoy y también en el futuro del capitalismo, y hablo de capitalismo democrático, en países ricos y pobres que están enfrentando una enorme crisis en los Estados Unidos que va a tener enormes implicaciones en el resto del mundo, en lo que hace a la falta de fe, y hay una microfe, diríamos hoy, muy pequeña en el sistema político, de manera que utilizamos las mediciones para determinar cuáles serán los patrones de mortalidad y desesperación en los Estados Unidos. Cuando hablo de mortalidad, hablo de mortalidad prematura, por ejemplo, por sobredosis, suicidio, uso de distintas sustancias. Obviamente vemos que está concentrado en la población menos educada, de raza de color, negra, y esto obviamente, si bien no me voy a explayar, creo que es una situación de desesperación tal que sí merece que lo mencione. En el proceso de realizar mi estudio basado en estas métricas, hallamos que aquellos que son vulnerables y se encuentran en estado de gran desventaja, los desposeídos, tienden a tener el mayor impacto negativo a raíz de la pandemia del COVID y no tienen el mismo efecto ni lo sufren que la población más favorecida. Hay una conexión entre estas dos grandes pandemias para la crisis en materia de salud. Por un lado el coronavirus y por otro la situación social, que genera muchísimos problemas, uno de los cuales es el gran desempleo con shocks, donde se están esperando en el futuro más de 75.000 personas que van a quedar sin trabajo, con lo cual vemos cómo está impactando negativamente esta situación en los Estados Unidos. Y además, para complementar lo que acaba de decir Marita, lo que nos dice la métrica sobre el bienestar es que no se trata solo de medir los ingresos, en muchos casos nos sirven como grandes indicadores, señales de alerta antes de que se produzcan las crisis de mortalidad, y esto hay que tenerlo muchísimo en cuenta. No se trata solo de hacer una medición del PIB, y esto lo vemos en Estados Unidos, lo ha hecho también Canadá, Chile, Nueva Zelanda, y han incorporado estas mediciones en las estadísticas oficiales desde sus gobiernos para complementar los datos meramente económicos basados en el Producto Interno Bruto. Lo que hemos visto en este aspecto es que no estamos yendo a preguntarle a las personas, ¿usted está contento? ¿Le gusta que su gobierno se maneje en un entorno de corrupción? No. Lo que nosotros hacemos es tomar muy en serio las mediciones sobre el bienestar, como por ejemplo todo lo que tiene que ver con satisfacción con la vida, estrés, preocupaciones, y a partir de ellos hacemos una determinación de los rasgos económicos y sociodemográficos para que nos permita de alguna manera establecer patrones que sean congruentes, que nos permita determinar cuáles son las situaciones de inequidad y desigualdad, inflación, desempleo. Esos son los índices que tomamos. Esos patrones congruentes y consistentes en todo el mundo respecto de satisfacción con la vida y los ingresos es lo siguiente: la parte económica es muy importante, pero también los aspectos de salud es muy importante, también las relaciones personales. Esto nos demuestra que también el tener una relación con otra persona, el matrimonio, las relaciones sociales son muy importantes para poder explorar cuáles son los efectos de la felicidad en cada uno de estos patrones. Por ejemplo, hemos determinado, y todos lo sabemos, que son más felices las personas que están casadas que aquellas que son solteras, pero no me puedo abundar mucho en ello porque ya tenemos poco tiempo. Otro patrón consistente que hemos vivido en todo el mundo, 142 países en todo el mundo, en la encuesta Gallup, aquí lo tienen, es la relación justamente entre la satisfacción con la vida y la edad. Muchas veces uno piensa que a más edad va a haber menos salud. No, puede haber más salud y también felicidad. Son marcadores indicadores de el bienestar para evitar justamente situaciones de ansiedad, de desesperación, de distrés que se producen en todo el mundo y uno piensa que lo van a tener más la gente mayor. Y no es así. Tiene que ver con las aspiraciones propias, individuales, sociales, también cómo nos relacionamos con los demás y también con las cargas financieras, de las situaciones económicas, de dificultad financiera. Entonces, a veces el adulto mayor se transforma en una persona más sabia y puede ser más feliz. Y también tenemos lo que llamamos el sesgo de la selección. Sabemos que la gente que es menos feliz muere de manera más temprana. Y aquí en la gráfica ven el punto medio, ven que está entre los 40 y los 50 años. La encuesta se aplica también a países europeos. Ahí en la crisis de la edad madura, que justo corresponde a la mitad de la vida, es cuando vemos los grandes desafíos más grandes. Muy rápidamente veamos a ver cuál es la situación de la desigualdad del bienestar, comparando el estrés en los Estados Unidos con el estrés en América Latina. En general, hoy en día lo que vemos que la gente en Latinoamérica tiene una situación menos de estrés permanente que en los Estados Unidos, pero sí hay una enorme brecha entre los ricos y los pobres, y ahí es enorme. Porque en los Estados Unidos, por ejemplo, los pobres reportan e informan tener un grado de estrés mucho mayor que en América Latina, algo que es realmente sorprendente también. Y hay otra brecha muy grande entre los ricos y los pobres en Latinoamérica. Tiene que ver con que, por ejemplo, si una persona trabaja duro en el país va a poder avanzar, que es el sueño americano, pero ya esto no es más así. Entonces, fíjense las respuestas. Esa brecha entre los ricos y los pobres en los Estados Unidos es 20 veces más grande que en América Latina. En el marco de referencia y entre los que contestaron no había grandes diferencias en cuanto a los ingresos. Hay grandes oportunidades, obviamente, para hacerse rico si uno trabaja, y ese concepto ya no funciona más en la actualidad. Y aquí algo interesante de ver en mi investigación. Hay grandes diferencias según los grupos raciales. Las minorías de origen afroamericano tienen más probabilidades de ser más optimistas que los blancos pobres. Y fíjense la comparación entre la población de origen afroamericano y la población pobre de etnia blanca. Entonces, allí las probabilidades se ven graficadas en las columnas. Y ¿el optimismo importa? Sí, en realidad aquí ven la tasa de mortalidad de los Estados Unidos comparadas con otros países. La línea roja son los norteamericanos blancos, 45 a 50 años, está aumentando. ¿Por qué? Porque hay desesperación, ansiedad, y en la mitad del gráfico tienen la edad. Pasamos ahora a la línea azul, que pone a los hispánicos, que en este momento está bajando la tasa de mortalidad, aunque parezca también algo sorprendente. ¿Por qué? Porque de alguna manera la población en general se está encontrando en un estado muy deficiente. Y luego de aplicar esta métrica para hacer coincidir lo que hemos investigado con lo que hemos Vemos aquí, hay indicadores que son las muertes por desesperación. Ha habido grandes cambios según la raza y el lugar. ¿Y cuáles fueron los hallazgos? El nivel de los individuales, teniendo en cuenta la tasa de mortalidad compuesta del CDC, del Centro de Enfermedades, de Control para Enfermedades, para aquellos que están entre 35 y 60, se correlacionó negativamente con la satisfacción con la vida y positivamente con el estrés y las preocupaciones. Es una causalidad bidireccional, se dan cuenta dónde importa la conducta, y esto ayuda porque si se hace más ejercicio físico, por ejemplo, se reduce la ansiedad y aumenta el grado de salud. Con lo cual, esto se detectó, por ejemplo, mucho en zonas de lo que llamamos el medio oeste de los Estados Unidos, que la vida es un poco más tranquila comparada con la vida que se desarrolla, por ejemplo, en la costa este. Para determinar los grados de ansiedad y desesperación, comparamos las poblaciones, como les dije, de origen afroamericano y también hispánico, que de alguna manera no tienen la misma importancia económica que aquellos que tienen mejores ingresos. Hay también indicadores interactivos, y no voy a abundar nuevamente en ellos, que nos permite determinar cómo funcionan estas tendencias por grupos raciales, también por el nivel de bienestar, y la medición que se hace en base a la tasa de mortalidad por desesperación antes y ahora además por COVID-19. Como ven, muy rápidamente, ya estoy terminando, quiero avisar. Tienen aquí lo que llamamos la geografía de la desesperación, y muestro esto para que tengan una situación general de cómo importa el lugar de análisis que hemos hecho según las diferentes regiones y estados de los Estados Unidos. Algunos tienen que ver con la composición racial, otros con la tasa de desempleo y por último con la cultura. Hay lugares donde hay grandes minorías, afroamericanos, hispánicos, tienden a ser más optimistas, y esto obviamente es muy distinto de lo que vemos en otras regiones. Y esto tiene que ver con la cultura, en fin, las tradiciones propias de las comunidades. Y estos grupos, por ejemplo, tienen más optimismo que los pobres blancos de Estados Unidos. Y ahora, bueno, me estoy extendiendo, tengo que cortar mi presentación. Ya, un minuto, muy bien. Voy a saltear y quiero decir algo sobre esto que es muy importante. Y tengo dos transparencias más. Una vez que vemos cómo determinamos la esperanza en los Estados Unidos, habíamos comenzado con el estudio en Perú y lo seguimos en Estados Unidos, tratamos de entender cuáles son los factores que hacen que de alguna manera haga que los adultos tengan más esperanza, más optimismo y en definitiva más resiliencia, puedan vivir vidas mucho mejores. Lo último hallazgo es que a pesar de que los afroamericanos sufrieron los golpes mayores en materia de COVID-19, ¿no? Tenían más esperanza en el futuro, optimismo y además en realidad mayor expectativa de vida. En realidad aquí pueden ver los gráficos para ver la diferencia, sobre todo en la población negra de bajos ingresos. Fíjense que estaban más satisfechos con la vida y tenían más esperanza para el futuro. Y en cuanto a la situación de salud mental, aquí tienen los informes y ven la comparación en la gráfica. Vuelve a aparecer la brecha que mencioné anteriormente entre pobres y ricos, que obviamente se hace cada vez mayor en los tiempos del coronavirus, porque se agregan circunstancias que son negativas y que de alguna manera atentan contra la preservación de la salud mental. Pero esperamos que a través de los estudios podamos entender cómo evitar los efectos derrame de esta situación. Y también estamos intentando realizar lo siguiente. En los datos que mostré anteriormente, ven, ansiedad, depresión, son factores muy importantes, suicidio, consumo excesivo de drogas, muerte por sobredosis. Todos estos factores que estamos estudiando, que habíamos estudiado en el 2019, se han exacerbado notablemente del 2020 debido a la pandemia por COVID-19, con una enorme incidencia en las áreas urbanas. Y también ahora hemos visto aumentar la tasa de mortalidad en las rurales. Y lo último que desearía compartir con ustedes es que si bien esta pandemia es realmente devastadora, nos ha llevado a entender mejor que debemos priorizar la neurociencia, el estado mental y sobre todo el bienestar para todos, factores que hacen que las sociedades puedan funcionar bien. Y creo que si bien estamos todos conmocionados y sobre todo los economistas y los profesionales de la salud en los Estados Unidos, en el sector público, en el sector privado, en todo el mundo, nos está ayudando, sin embargo, a tener una aproximación y un enfoque mucho más amplio para el crecimiento económico en un entorno de bienestar. Estos otros aspectos que tienen que ver con el bienestar humano en una sociedad que habían sido olvidados anteriormente, están siendo puestos en el tapete hoy. Thank you, Carol, so much. Thank you, the three of you, for your wonderful presentations, filled and laden with data, which are so important to give information on public policies and also to understand phenomena such as well-being, because, of course, we need evidence-based. And therefore, as time is very short, I will ask a question.
This question is targeted to all three of you, Florencia, Marita, and Carla. Please do not take more than 1 minute. It's a very specific and direct question, and the idea is for you to please summarize in 1 minute what recommendations you would give to the governments in our region to increase the well-being of people during the pandemic, and why you would choose that recommendation in particular. Florencia. Thank you, Fernando. Since I'm not a specialist in well-being, and I believe Marita and Dr. Graham are going to do a better job, I will say something very brief, thinking of a more holistic well-being as regards public policy. I believe the use of what I mentioned for public policy, for instance, promoting the use of masks and social distancing in a general way instead of choosing different places for individuals. It is a minor mental capacity required. Imagine if they should remember where to wear it, where not to wear it. That would be a public policy related to simplified communication to improve mental well-being. And I will say 3. Second, a unified message. Something that Facundo Manes always says. Partisanship should no longer be that separating the tribes. Rather, having a unified message by governments would no longer distract individuals who would be able to focus on one message only. And finally, it seems that these messages, as mentioned by the other speakers, everything related to our loved ones and the social media, all of that, and our relationship with them is more effective than the economy. And this has happened in the past as well, even as regards risk perception. I think these 3 messages should be taken into account for the design of public policy. Thank you very much, Florencia. Marita? Well, I would say the following. First, I would strongly focus on health policies, including psychological health, which is left behind. With a pandemic like this, it is more urgent than ever before. So everybody should have access to psychological treatment and also help people, ordinary people, to develop their own skills to face this situation. This is something that can be done from different fields, but also from the government, at schools, at workplaces, etc. And another thing that I believe is urgent is to solve the issue of the technology gap. We don't know how long the pandemic will last, whether children will go to school or not, but the truth is there is a very significant social injustice that needs to be solved, a gap to be bridged, which is a technological divide. And then anything related to building social capital, increasing transparency, generating better community relations. All of these would lead to a narrower gap, reaching more consensus, and losing this lack of confidence that we all feel. Excellent, Marita. Thank you, Carol. I will be very brief. I'm going to the point of the importance of mental health, psychological health, and well-being. I believe that a very important step is to have these measures, these well-being measures, measuring psychological well-being as official statistics. We are not just academics, scholars like Marita or myself doing our work and taking data. You can see this when these data are used by countries as part of their statistic production systems. That puts them in a better position to prioritize these in their public policies. No doubt, when statistics are official, when there are progress indicators or things like that, if they have the temperature of the public, of society, when there are economic changes or economic progress or things like that, that changes the discussion about public policy in a way that will not always be there if we only measure income. So I think that would be the contribution that INECO and others can make, as well as other panel members. We cannot contribute to that. Thank you, Carol. Thank you very much, all three of you, for your hard work and sharing it with us, leaving us with a lot of data and ideas to think and continue to improve the well-being of our societies. Thank you very much. Let me clarify. This round table, as you know, there are more than 15,000 people enrolled in this conference. And for this reason, there will be some adjustments to the platform. So should you have a problem with the connection, please come back in or refresh your screens, because these changes may relate to fixes to the platform since we have so many participants. Now I will give the floor to Teresa Torralba, who will introduce the next speaker and the next presentation. Thank you very much for sharing this time with us.